So you've had lower back surgery, you've had fusion, and now you've started having what you consider to be incontinence or weakness in your pelvic floor. But then maybe you already had that, and did your lumbar fusion happen as a result of the weakness of your pelvic floor? That's a good one. So that's what this video is all about. Stay tuned. Hey, this is Dr. Shakib from Core Pelvic Floor Therapy right here in Irvine, Orange County. A lot of times we have these different scenarios, but they're really related. They're different chapters of the same book, but we don't see it as such. We look at them as two separate situations. And one of the ones that I can guarantee you is if you have pelvic floor fusion, not pelvic floor, lumbar fusion, if you've had a surgery of your lower back, you do have pelvic floor dysfunction. So pelvic floor dysfunction is not about incontinence. I've done a video on what pelvic floor dysfunction is. We're going to make sure we put at the end of this video so you get to watch it to better understand it. But if you have had fusion or surgery of your lumbar spine, of your lower back, you do have pelvic floor dysfunction with or without incontinence. So when it comes to pelvic floor dysfunction with lumbar fusion, the areas on the external aspect of it that need to be addressed are your adductors, your inner thigh, your obturator muscles, which are the hip external rotators. They're the ones that make you do this. Your piriformis, your lower back muscles that are multifidi and paraspinals, your gluteus medius and minimus. They have to be addressed. No one's touching them unless, I don't know what the criteria is these days, that the practitioner decides what to do. The whole key here is you don't go get massaged in those areas. You don't go isolate those areas and try to work them out, because those muscles are not in an isolated fashion. They're all working together. So the whole mobility of your hips, of your lower back, of your pelvis and sacroiliac joint, the breathing, how you're breathing, all of these need to be evaluated. All of these need to be worked out. So if you're thinking, oh my gosh, there's so many things to address, yes, it's not easy to be healthy, but your alternative is not a good neighborhood of thinking or a good neighborhood of living. So spend the time to understand where you stand on this spectrum, where your weakness is, how to fix it. I'm going to make sure I put the video I did on functional movement at the end of this video so you get to see what's available. If you have not read my blogs, make sure you address these blogs, you check them out. You can find the information in the description box. If you need to be seen to see where you stand, please make sure you make an appointment. You give us a call, and I'll be more than glad to take a look and see what your story is. Please subscribe to the channel, and until next time, take care.